Wellbeing is massively important, especially within nursing, as there's a great deal of research which has shown that nurses with higher levels of subjective wellbeing deliver better patient care and are more compassionate. So if we can all improve our wellbeing, that'll only improve the care that we give to our patients.
Fully supported staff are then able to go on and support the service users that they work with.
In West London, we've made a commitment to the wellbeing strategy for the workforce to ensure that every employee in every role is supported with the right conditions at work to be able to give of their best. The pandemic has reminded us all that we are all different in the things that we find helpful for de-stressing and rebalancing and switching off. These skills have never been more important at this time. I'm going to hand over to Nina and Ali, who have been leading for North West London within our Resilience Hub, to tell us about some of the things on offer.
I have a responsibility for ensuring that the Trust takes health and wellbeing seriously, and it's seen as an integral part of our workforce strategy. Part of the Guardian role is not only sharing the latest data and information with the Trust Board about what's happening on health and wellbeing, but is actually, most of it is about listening to the staff and making sure that we're being responsive.
Over the last 18 months, we've developed a range of health and wellbeing support for all of our staff. We've trained a number of mental health first aiders and wellbeing champions, and we'll continue to do that so that all teams and departments have access to these important roles. In addition, we've also produced courses that are new, including mindfulness training, work-life balance, and our compassionate and inclusive leadership training. So we've actually got so much to offer in relation to health and wellbeing that we've had to develop a dedicated exchange page, and we've done that on the back of staff asking us to have everything in one place so that it's easy for them to access and understand just how much is actually available to support health and wellbeing.
We've been training staff health and wellbeing champions. To be a champion, as in any other area of life, is simply to have the passion to support others and really listen to what matters to them. And we ensure that our champions have access to the latest resources so that they can direct you to them.
Mindfulness gives us a possibility of stepping back, reorientating or grounding ourselves, and then being able to respond to the situation in a skillful way.
Working from home, staff are really isolated and are having to deal with some really difficult situations on their own. We have to look after ourselves first before we can look after other people, really.
Part of my role is to signpost staff to resources and to support the provision of reflective practice within our service.
We're really proud to welcome Project Women, who've provided the Wellbeing bus Wellbe to the Trust for 2 weeks to support our amazing workforce. Project Women is a charity made up of current and former aircrew. Wellbe provides a space for staff to unwind and de-stress and enjoy the facilities of a first-class lounge environment.
34% of our workforce told us in the 2020 staff survey that they also had caring responsibilities outside of work. And so one of the key things that we've developed recently is the carer passport for staff. And this will enable staff to have those detailed conversations about what would really support them when they're caring for others outside of work.
Some of the frontline staff, when we sort of interviewed people, were less inclined to open up emotionally about the kind of things that they were going through at work, because some people were sort of saying to us, it felt like that might open the floodgates. We had hundreds of submissions from the ECP, and then what we did was our art therapist, she looked at them and then kind of put them on an online virtual gallery, and then we had our music therapist contributing music to the online gallery, and then people could go in and see their artwork and see other people's artwork, and actually it was really validating. It really helped people to kind of think about themselves, and also was able to sort of normalise some of the experiences because they could see the art of others.
Supporting of health and wellbeing of staff, and particularly nursing staff, is critical really to all that we do. If we don't look after ourselves, there's no way in which we can look after all of our patients. How we take care of each other is fundamental, and I'm just so passionate about making sure as a nursing workforce we're thoughtful around each other, we take care of each other.
So looking forward, our hope is to keep staff health and wellbeing centre stage and ensure we have a compassionate and inclusive culture for West London.